there's many problems with DNA deficiency. I'm going to focus a little bit on AIDS today, HIV and some of the symptoms in a small study I did, and maybe something related with diabetic neuropathy. I'm going to just skip this one because it comes up again. So I want to just show you a few of the connections between vitamin B12 and HIV infection. I have sort of a lot of material. I may just go a little faster, you know, but there are connections with B12 deficiency and AIDS patients. The problem is that not every study shows it, and the problem with that is that vitamin B12 levels in the blood is not a good measure of how much vitamin B12 you have in your system. Because if you have an injured liver, then the liver will spill out higher levels of B12. And then that will show up in your blood. And you say, oh, you have plenty of B12. Yeah, but it's not functional. So, and there are other measures. And the best thing, if you look at some of the general practitioners and some of the older doctors, they'll say, take it. If you're feeling a little weak or a little anemic, take it. And if you feel better, then you were deficient. It's the best way to see it. And it's very harmless, and it's essential for everyone. And so one of the problems with HIV, which was very demonstrative, is that people who were suffering from that got neuropathy, numbness and pains and tinglings, mostly in the legs and also in the hands, in the long nerves. And that's also a symptom of B12 deficiency. Other symptoms of B12 deficiency are weakness, tiredness, anemia, depression, manic, the psychological problems. Also, it's related to MS, multiple sclerosis, Alzheimer's, memory loss, shrinkage of the brain, deterioration of the spinal column. So you see there's a lot of neurological manifestations. Weakness of the muscles, slow growth in young children and infants, you know, retarded growth patterns, and you see that with starvation, of course. I mean, in cachexia, also there are deficiencies caused by, most of it is you don't take enough of it. If you're a vegetarian or vegan, you're bound to be B12 unless you supplement. It would be, it might take 3 to 5 years because B12 is stored in the liver, and the amount that you need per day is in micrograms, maybe 2 to 5 micrograms per day, and you can store several grams in your liver. So if you divide that, micrograms or millions, it may take 3 to 5 years to become deficient if you stop ingesting food that has B12. And it's not in vegetables. The highest levels are in the liver. How many have had liver in the last month? How many like liver? I'll raise my hand twice. It used to be very common, healthy, you know, especially during the war and afterward, World War II. They gave nutrition, and that was very, you know, once a month people ate liver. And they have different ways of preserving it. Also, it's in shellfish and clams and oysters and mussels. So the liver and those shellfish are very high levels. Then it's which is maybe 40 micrograms, which is 20 to 30 times what you need per day. So that's why you just have it once in a while. You replenish your stores. But then you would have something like eggs has it. Maybe an egg or two would be a daily dose. You know, the yolk. And if you just have the white of the egg, it's like nutritionless. It has no value. Except you say, look at this, you know. Or the muscle, I know the muscle blend is no fat, no B12, no brains. Body expression. I mean, you can be strong and without trying to have no fat. It's an absurd way to try to be in shape. But none of the it's not produced by animals. It's produced by microorganisms in the ruminant, in the stomachs of ruminant animals like that graze, and so people or species that eat them get it. So you do well to have those type of meals, and most cultures have that as a, you know, if you look at cultural meals, they have meat, small amounts, and livers and all that gonad, you know, not gizzards, probably is in, you know, gizzards and heart and stuff like that, you know, that are in, if you ever cut up a turkey, you know, and make the gravy, you would add that. So the neuropathology, it affects mental, it affects psychological, also physical, and you'd be surprised. There's dozens and dozens of disorders and diseases that the deficiency of B12 is related to. It is the most underdiagnosed disorder in the United States and throughout the world. The underdiagnosis of vitamin B12 deficiency. It causes the homocysteine to increase. Homocysteine is related to Alzheimer's and cardiovascular problems. So it has to do with cardiovascular health and carbohydrate metabolism and the metabolism of nucleic acids. How more important is something if it's related to your DNA function and synthesis? Every cell has to be replicated. In terms of HIV, deficiency is known to have occurred at early stages. And they have incubated certain forms of vitamin B12, hydroxyl B12 in particular, and shown that it inhibits in the test tube the reproduction of HIV virus. Many of the drugs that you take, that HIV drugs, cause vitamin B12 deficiency. And so the symptoms of AIDS overlap with the symptoms of vitamin B12 deficiency. And when I show, I'll tell you something about brief study we did about AIDS and people taking HIV and inhibitors and vitamin B12 for 6 weeks, and they almost all their symptoms improved. And their symptoms are manifold. There's like 28 symptoms that are related to AIDS, HIV. And each person that has it normally has about 8 to 12 or 15 of those symptoms. And we'll discuss a few of them, but it's a shame that they have to go through this. So it's what happens with HIV and other type of things. It's uptake through the intestines is interfered with. So it's from the drugs and the injury to the liver from certain drugs, and the practices that people would have would also inhibit the uptake of vitamin B12 into the system. And then alkyl nitrite inhalants, called poppers, which are used to accentuate some sexual practices. They also deplete vitamin B12, nitrites. If you take laughing gas from a dentist, that binds to the B12 and knocks it out. And so it's very unhealthy. For some people, their teeth turn yellow with laughing gas. And then they're a little wiped out. Their brain is totally deficient. So it's not a good practice to have that. I had it once or twice, and I've never been the same. So I didn't like it. I thought I was in the Star Wars picture. Because they were trying to, play a picture while I'm doing some process, and and awake, and they gave me that, and I'm like, I thought I was in the middle of the scene, and I was the victim. That was just my only experience with the nitrites. And these are what it does is inactivate methyl B12, which is one of the essential forms of vitamin B12, and it also lowers. See, here we're talking about recreational drugs has a negative effect in general. And like anything, any drug or anything, it's how much you do and how often. You know, once in a while, things generally don't bother you. You know, but if you're doing something habitually, then recreational drugs will take their toll in vitamin B12, such as smoking, and also even as it also very often lowers vitamin C. You've probably heard of that. And there's a relationship in which vitamin B12 and vitamin BC help maintain each other in the reduced state. And also, I don't want to get into too much of this, smoking for marijuana also does a similar risk. That also tends to distort your brain function. And generally, whenever you're taking drugs, hard drugs like that, or drugs that have a psychoactive effect, you stop maturing socially. Whatever you start, if you do it at 14, then if you do it for 10 years, then you stop, you'll have lost about 8 years or 10 years of your social skills, and you'll still be acting like an immature 12-year-old, 14-year-old, 18-year-old, whenever you start or whatever. And because of what it does, it's like a big filter out there, so you're not taking in things. So here we have poppers, tobacco, marijuana, alcohol has a similar depletion effect. The doctor told me that about the B12 with the alcohol. I said, I don't smoke anymore, I don't do poppers, and marijuana, never agreed with the alcohol I drink. But when he said you have to, what about the alcohol? I said, can't you operate? So that's still out there. I didn't want to give that. No. You can't be 100% angel, it's, okay. Now, have you heard of oxidative stress? I mean, I get stress, mostly from students. Oxidative stress means it's the sum total how the body reacts to various forms of stress when it's getting overwhelmed. And it has to do with the formation of free radicals, excess amount of free radicals. Free radicals are important. They're an important part of the immune system to attack certain organisms and to destroy things that are not good for the body. But when they go to the excess, then they start harming healthy tissue. And so there are mechanisms to neutralize the radicals, the free radicals, which means unpaired electrons, which mean they interact. If you have some free radical and they bang into DNA and cause a break, and so then there has to be a repair. And if you can't, if there's too much damage, you can't repair it, and then you'll have faulty DNA mechanisms, and ultimately your proteins won't work efficiently right. You won't make them, and you have certain disorders, and you die. You get sick longer and more frequently, and you die sooner. The more free radicals. That's part of the aging process. The body it can't cope so much with the aggregated amounts of damage. So when you're young, you can do anything and all that, but it takes its toll. Unless you're careful, sooner or later it takes its toll. But it just depends on how well you treat your body. And psychological treatment is very good too. So it doesn't mean you don't have any dessert, you don't have any recreational drugs, you don't do any of this. Then you become neurotic, and that's even worse. Just be good 75% of the time. Very good. And then the rest of the time, have fun a little bit. Within bounds. So vitamin B12 plays an important role in maintaining one of the most important free radicals. The most important intracellular free antioxidant. It's called GSH. It's called glutathione. Reduced form of glutathione, abbreviated capital GSH. So that is the most important intracellular antioxidant in the body. If that gets depleted, you're aging. And people who have longevity have high levels of GSH. In study, you might think of HIV as probably the most best example of what the aging process and the destruction of the immune system is. It's pathetic, but it's run down. And what happens is that the body's ability to generate and regenerate reduced glutathione decreases and decreases and decreases with the onslaught of this virus and its products. And then if you don't succumb, if it goes to a certain level, then the body dies. It can only take so much. And if it's untreated, that you can see the course. You could just see the dots, the glutathione decreasing until it gets to a certain low level, and then the body expires. You can do the same thing with body weight, with either a starving infant or a cancer patient or someone dying from AIDS. That it gets to a certain level where it's called cachexia, starvation, where you just can't eat, and the body actually metabolizes itself. The muscles are broken down to get the glutathione. And if you've ever seen anybody dying from cancer, from HIV, or you see on TV these poor little babies in Africa or in